You go to the emergency room, check in, and sit down. For the next few hours, you stay right there in the lobby, never even seeing the inside of a proper patient room. Then the statement arrives. For a few hours occupying a lobby chair and a handful of routine tests, the gross charge from the hospital is $14,136. This exact scenario happened to a patient at Mercy Medical Center in Redding, California, a case investigated and published by the local news outlet Shasta Unfiltered. Even after the hospital applied massive insurance adjustments, they still demanded $739 from the patient. They followed up the printed bill with relentless automated phone calls demanding payment, but the math didn't add up. Medicare had already paid $727, and supplemental insurance covered another $167. The actual out-of-pocket cost legally owed by the patient was exactly $34.10. A $700 overcharge on a routine visit stems from a sprawling, intentionally opaque financial system designed to disorient patients when they are most vulnerable. To understand how a bill inflates to $14,000 in the first place, you have to look at the hospital's internal master price list, known in the industry as the charge master. This master document sets arbitrarily high prices for every test and supply. Insurance companies negotiate these down with steep contractual discounts. But if secondary benefits aren't coordinated perfectly, those discounts aren't fully applied. The patient is left with an inflated residual amount. Worse, the statements mailed to patients often omit the line-by-line itemization entirely, presenting only a confusing bottom-line total that makes it nearly impossible to check the math. The ChargeMaster system thrives on this lack of clarity, turning the aftermath of emergency medical care into a maze where patients are pressured into paying totals they do not actually owe. The parent organization behind the local hospital is Dignity Health, an affiliate of Common Spirit Health. It operates as a tax-exempt 501c3 nonprofit organization. Based on recent IRS filings, Dignity Health had $11 billion in expenses, but pulled in $11.6 billion in revenue. From that, CEO Wright L. Lassiter III received a compensation package of over $14 million. He is not an outlier. According to the same tax filings, at least 17 other executives of the organization pulled in seven-figure packages, with the highest among them taking home nearly $6.7 million. When questioned, large health systems routinely defend these salaries, arguing that managing complex, multi-state operations and providing charity care requires highly competitive pay to attract executive talent. Dignity Health also points to online price transparency tools and machine-readable data files on their website, arguing they empower patients to estimate out-of-pocket costs upfront. Yet an online estimation tool offers little comfort when the hospital's billing department is aggressively deploying automated phone calls to collect hundreds of dollars in inaccurate residual charges from an everyday patient. So how did the patient in Redding finally stop the automated calls? They pushed back using their explanation of benefits, commonly known as an EOB. The moment the patient contacted the billing department and read out the authorized Medicare payment numbers, the hospital immediately corrected the balance down to the proper $34. Under federal HIPAA laws, every patient has the right to request a fully itemized medical bill that includes the specific medical codes for every service rendered. This diagram shows the most effective defense mechanism you have, cross-referencing your hospital's final statement directly against your Medicare summary notice or your private insurance EOB to ensure the payments match perfectly. Without aggressive verification, simply paying the bottom line total printed on the initial summary places you at high risk of overpaying for administrative errors. Shasta Unfiltered brought this specific local gap between executive pay and patient billing into public view, highlighting the role local reporting plays in providing transparency for the community. In an industry overseen by highly paid executives and governed by arbitrary price lists, your best protection against inflated charges is strict, uncompromising self-advocacy.